Hello, everybody.
Hi, it's Liz Janowski and Dr. Janowski, and Dr. Janowski is obviously the Dr. Janowski of Sonata Aesthetics, and I'm Liz.
My lovely wife,
Yes.
who not only runs the practice, but is often a patient here at the practice. As you can imagine, Liz has access to everything that we do, and we want, of course, to offer procedures to her that are appropriate for her and that don't make her look overdone, right? So you may have seen other plastic surgeons' wives or something. They just look plastic, right? And that's not really a good way to promote their husband's business. But this is a business that we run together, and we enjoy that very much. But from a clinical perspective, I'd like Liz to talk about a little bit about the things that she's had done, and what your experience is, what you like, what you didn't like, what are your favorite things. So you'll have a unique perspective. So
What I really appreciate is that oftentimes in the different friend circles that I am in, people are very surprised that I have had anything done. And of course I have, but I appreciate very much that I look natural to people. I still look like myself. I'd say I look like a more youthful, maybe more classically proportioned version of myself. And so that speaks to one of my very favorite treatments that I would do even if I wasn't in this industry and I was, coming just to get services. I would always come to Dr. Janowski, but Dysport in the jaw, or Botox, Dysport, they're all exactly the same thing, in the jaw has been a life changer for me because I am a teeth grinder. I had a square face. You can see it in my grandmother's face, my mother's face, kind of this blocky face. That it wasn't as flattering to me. It sort of like drew my face down. I mean, I've had it since I was a young girl, and it takes time because the muscles in your jaw kind of need to relax. But not only do I not grind my teeth, which is much better for my teeth and much better for my headaches, and my facial shape is just a lot nicer, more feminine.
You can see in the picture, Liz has a very nice oval-shaped face, and that's according to many experts, that's kind of the ideal shape, right? It's an oval, and it tapers down. So we can maybe find an old picture to show you, but she was quite square, and there's nothing wrong with having a wide square jaw. Many women have it, many models have it, but the masseter muscle right here can start to bulge out from grinding, clenching, or it's just naturally that way, and it can sometimes masculinize the face a little bit for females. So if we can do something very simple, which is to inject right here and here, we can actually taper it down, and Liz had a very dramatic improvement. And again, not to mention the improvement in her symptoms. So I agree, that was a great choice.
A great treatment, and a treatment that most people can afford, and kind of for me a slam dunk treatment. I love not grinding my teeth. I don't even like chewing gum anymore because it's just not, I don't have that same like clenchy feeling. I'd say I'll just give two today. My second one that I love getting because I do a lot to maintain my skin, lasers, RF microneedling, occasional fillers. I really don't need a lot of volume. So when I want to feel more refreshed, or I feel like I'm looking really tired, I love to do, it's not something you should do all the time, but occasionally do either one vial of Sculptra all over my face, which Dr. Janowski will inject kind of all over, or one, it's kind of the equivalent of a vial of my own PRP, which is my platelet-rich plasma, which kind of stimulates collagen. Those make me feel like, it doesn't really add any lift, but it adds sort of like nourishment to my skin. It makes me feel pretty.
Liz has a beautiful glow to her skin, and both of those products will do that. Sculptra through the tiny little particles that stimulate collagen, and Sculptra is mixed with water, and so we just kind of inject it like a liquid all over the face. And if we just use it in small amounts, we're not going for volume. You can also get volume out of Sculptra, but it does make that skin glow. It's wonderful. I think everyone should do a vial a year. It's just a wonderful preventative as well. And then PRP stimulates new blood vessel formation. It helps with collagen growth. It gives a nice shine and glow to the skin. So I agree. Liz has beautiful skin, and that's part of the reason other things that you're doing or good product? What do you like in the product category?
I mean, I think if you're a fair-skinned person or a person that struggles with pigment, doing the Obagi kits with the hydroquinone will change your life. I like to use a vitamin C every day. There's lots of kinds. You can buy ours or not. Ours are just maybe a little bit higher grade.
What's the brand of that?
Medical grade. We have ones from Obagi. We have ones from Skin Medica. We have a few choices. And then I use the hydroquinone products from Obagi, Retin-A. Everyone should be using Retin-A every night. And of course, I am religious about sunscreen. I put on sunscreen. Sunscreen, I tell all my friends this, I'm like the sunscreen police, only lasts 2 to 3 hours. So if you put it on at 6 a.m., yeah, it's not on anymore. When you go out to get lunch and you sit out in the sun, or even like my office has windows, I'm receiving sun damage all the time. So wearing sunscreen versus not wearing sunscreen is the difference between looking really old when you're 40 and not looking really old. So sunscreen, yes.
Yes, now that I have a beard, I do look like Liz's father. She looks about 25. Curiously, would anybody want to know what I've had done?
Sure, I mean, go
Actually,
for it.
very, very little. The one thing that I do occasionally is IPL.
Which
So
you
IPL
need again.
Is IPL. Intense pulse light will remove sun damage. I'll
And-
admit it, I'm not great with the sunscreen. So, particularly across the mid-face, I can get very brown and freckly very easily. So at the end of the summer, I'll often do IPL to get the brown spots off. There's no recovery from that. Also help with little blood vessel formation here. So IPL is something I do on a pretty regular basis. That's about it. I mean, what else have I had done?
You're going to do a neck lift?
Oh yeah, I've had the halo done. The halo is really good for, again, skin rejuvenation. It will help with pigment too. I am going to get a little lipo in the neck here and the tummy. That's a secret, don't tell anybody. So I'm actually going to get the same procedures that I perform on other people, on myself. I've had an upper blepharoplasty, which is something I do. Upper bleph means there's a little extra skin on the hood of the hooding the upper eyelid, and so it's upper eyelid surgery. It's just a minor procedure where we take some of that skin off. That's a procedure I perform. I did not perform it on myself. I had somebody else do it. But that's a great one. That one will last 10 years, and I had it about 3 years ago. And I was very pleased with that.
Yeah, so we love serving you. Dr. Janowski's been doing this for 15 years, which is very long in the aesthetic industry. I've been working by his side for 7, and we really love to serve. We really believe that we can empower you to live your best, most confident life. I love that. I like the way that I look. It's, don't have high confidence days every day. No woman does, but generally I feel really good about myself, and it really helps me relax and just focus on other things I do, like motherhood or making art or running this business, because I'm not hyper preoccupied with how I look, and I credit that to just feeling very confident. And so we both feel very lucky to provide that for our patients as well.
Yes, and I think you look beautiful.
Thanks, guys.